Hey guys, how's it going? Dr. Monty. So today we're kind of going on a little field trip in the office, and what we're going to talk about is our imaging system that we use here. And what we have here behind us is a cone beam CT. So what that is we can take traditional panos on this as well as cephalometric x-rays for people that are going to be in braces and things like that. But one of the neatest things about it is like I said, it's a cone beam CT. So what that does is as this thing moves around your head, it takes individual pictures all the way around. And then at the very end, everything collects, and then you can end up with a 3D image of your entire skull. Now we use this a lot for a lot of different things. We can use it to look at root canal teeth to make sure that we got all the canals that are sealed up in it. We can also use it for implant case management. And that's where we look and make sure you have enough bone to be able to put implants into. We can make sure that the anatomy of the rest of your skull is good and suitable to be able to put an implant into. And we really need that 3D model to be able to see that. So what I was going to do is kind of show you one of our patients that are up here. So what you get whenever you get a cone beam is you end up with these 4 different images that are right here. Okay. Now this one kind of goes from the top down through all of your teeth. Okay. This one here goes from the front to the back, so you can scroll through it and you can see all the teeth that come in there. And then this is from the side to side. So you kind of go there, you scroll it, and you can see everything as you go around. And in the end, you end up with this. What it is a 3-dimensional rendering of your jaw itself. You can come over here and see, and it's really neat because you can spin it around and you can look. Now this cone beam was a little bit too short for what we needed, so we took another one. But what this patient needed was implants back here up top, one here on bottom, and then also one here in the front. So what I'm going to do is I'm going to pull up his image so you can see exactly what it looked like whenever we got it all finished up. So what we do is we then, after we take this cone beam picture of each one of our patients, we'll then send it to a lab, and what we'll do is we'll use that information to be able to make surgical guides for implant placement. So that allows us to make sure that we're putting all the implants in at the proper angle to make sure that whenever we put the crowns on those teeth, that they're going to match up to the rest of your teeth that you have. And this is just an example of what one would look like after the implants and stuff get placed. So I'll just pull this up because it's a lot easier to see. So this patient needed 2 implants in the back, 1 down here on the bottom, and then 1 here in the front. So what we can do, we can bring you back in and we can make sure that all the bone, that all the implants have integrated properly into the bone that's there. And this patient, everything looked absolutely wonderful as we were going through stuff. And go through, and like I said before, look at these different slices to be able to see everything. So it's a wonderful tool to be able to capture a lot of information. And it's really, this is where dentistry is moving. So I just wanted to give you guys a kind of a little idea of what it is that we can do here for you and why it's so useful. So thanks.